Welcome back to another episode of HealthCap Weekly Wrap.
If this is your first time joining us, this show is where we break down the biggest news and updates in senior living. Everything from clinical best practices, to policy changes, to tools that make life better for residents and staff.
And if you're a regular, welcome back. We're glad you're here. We know how fast things move in senior care, and we're here to make sure you never miss a beat.
This week, we're diving into some exciting developments, like how artificial intelligence is helping identify health risks before symptoms even show up, and how new funding is empowering communities to prevent falls in older adults.
We've also got practical tips from PharMerica on glucometer care and respecting residents' rights during medication administration, plus a refresher on a free CMS training tool your team should definitely be using.
So whether you're a director of nursing, a wellness coordinator, or someone working the floor, there's something in here for you.
Because at the end of the day, better care starts with better information, and that's exactly what we're here to give you.
All right, let's get into it.
So there's some pretty incredible news coming out of two separate studies this week. AI is being used to identify serious health risks in older adults before symptoms even show up.
That's wild. Like, we're not just talking about diagnostics anymore. This is full-on prediction.
Exactly. The first study out of China shows an AI model that can predict cognitive frailty, things like early memory loss and physical decline, with 84% accuracy. It uses data from standard health screenings, sleep patterns, and even mood assessments.
That's a game changer for care planning. Like, imagine being able to get ahead of decline before families even notice something's off.
And then, in the US, researchers developed a second AI system that identifies older adults with recent exposure to long-term care who are at higher risk for drug-resistant infections.
Yeah, like MRSA, CRE, or C. diff. Those are tough to treat, and even tougher to contain once they spread.
The system helps hospitals and senior living teams spot those residents early so they can adjust infection control plans right away before things escalate.
Honestly, anything that gives staff a heads up is huge, especially with the speed infections can move through a community.
And it's just the beginning. These tools won't replace clinical judgment, but they can definitely support faster, smarter decisions at the point of care.
So while tech is getting smarter, funding is also finally landing in the right places, like fall prevention. This month, 18 community-based organizations got major grants to try out flexible, culturally tailored programs to help older adults avoid falls.
Nice. So it's not just one size fits all?
Exactly. These grants, up to $290,000 over 2 years, let each organization select from a menu of strategies. Some are offering strength and balance classes, others are focused on home modifications, and a few are digging into behavior change and risk education.
That's so important because what works in a large metro area might not connect at all in a rural community.
Right, and these programs are built with community advisory boards. That means the people being served help shape how the programs are delivered.
That makes a big difference. Buy-in goes way up when residents feel like they had a say in the process.
United Church Homes is a good example. They launched two programs: Stay Strong, a virtual fitness class, and Steady Steps, a small group workshop. Together, they're expected to reach over 3,000 older adults.
And they're live streaming across multiple locations, right? That's a great way to scale without losing that personal feel.
Then there's Quality Insights in West Virginia. Their program combines physical activity, cognitive engagement, emotional support, and even help navigating transportation or other barriers.
It's like they're building a full wraparound system, not just fall prevention, but total wellness.
Exactly. And with fall still being one of the top causes of hospitalization for older adults, these kinds of community-based programs could be a real turning point.
Now let's shift to something a little more clinical: glucometer use. PharMerica just released two great resources, one on cleaning and another on calibration. Both are packed with helpful reminders for staff.
Glucometers are one of those tools you use so often. You kind of forget how much precision goes into keeping them reliable.
Exactly. Starting with cleaning, devices should be disinfected with EPA-registered products after each use. The guide stresses following the manufacturer's instructions closely, no shortcuts.
And let's not forget how many residents have diabetes or prediabetes. One missed cleaning could easily lead to cross-contamination between residents.
Right. The guide includes a checklist that makes it easier for teams to build consistent cleaning routines into daily workflow.
It's also a good idea to tie this into infection control audits. Double check that the right products are being used and logs are up to date.
Now, for calibration, it's all about accurate readings. The second resource explains when and how to run control tests, like when you switch test strip lots or batteries.
And I liked that it gives specific examples of what to do when a result seems off. It's not just technical, it's really practical.
Exactly. It even reminds staff to check the expiration dates on control solutions, which is something that slips through the cracks all the time.
And here's the thing. If your readings aren't accurate, the whole care plan can go sideways. Med errors, missed trends, unnecessary interventions.
So, yeah, these two guides are short, easy to follow, and make a great addition to your next in service or morning huddle.
PharMerica also released a great refresher on resident rights in medication administration. And this one really ties into dignity and autonomy.
Yeah, this is the stuff that makes a difference in how residents feel day to day. It's not just what we give them, it's how we involve them.
Exactly. Residents have the right to know what medications they're taking, why they're taking them, what side effects to expect, and, most importantly, they have the right to refuse.
And that refusal has to be respected. No pressure, no guilt trips, just support and clear communication.
The guide also touches on timing. Meds should be given consistently, but staff need to be flexible when residents want to adjust routines.
That's especially true in memory care where trust and rhythm matter. A rigid schedule can backfire if it's not built around the resident's preferences.
It's also a good reminder for staff to document those conversations. When residents are part of the decision-making, outcomes usually improve.
And it strengthens family relationships too. Transparency builds confidence, especially around medications.
All right, last up, let's talk about training. CMS offers a free platform called QSEP, and honestly, more communities should be using it.
Yeah, if you've never logged in, it's packed with self paced courses on infection prevention, survey prep, abuse reporting, and more.
There are modules for frontline staff, nurse leaders, and even facility administrators. Everything is geared toward building stronger, safer care environments.
And since it's from CMS, it's survey aligned by design. That's a huge advantage when prepping your team for inspections.
It's also great for onboarding. New hires can knock out essential training in a format that's consistent and easy to track.
And even seasoned staff benefit from refreshers. You don't always realize how fast guidance changes until you're behind on it.
So yeah, QSEP is one of those tools that costs nothing and gives your community a big boost in preparedness.
That's it for this week's HealthCap Weekly Wrap. Thanks for spending time with us.
If you found something helpful today, share this episode with a colleague or your leadership team. It's an easy way to spark a conversation and raise the bar for resident care.
And don't forget, you can find more details and links to every story we covered today in the weekly roundup on Angie's blog at healthcapusa.com/Angie's blog.
Take care, and we'll see you next time.